I am not convinced that the marketplace in a competitive perspective is working.
Well, I brought the information from the Jackson County party, but it sounds like it's already been voted down. I thought this was a great idea, this action plan for affordable health care.
The action plan for affordable health care never came to an official vote. Just to put it on the agenda was voted down.
What do you think actually will happen at the hearing that's here today?
Well, I think we'll get what we've received in this country for more than a decade from the party that's been controlling much of the legislative branch in the Congress and in state houses. We'll get a lot of listening sessions. We'll get a lot of talk. We'll hear a lot of dire stories. We'll hear from a lot of people who are desperate or who know that they could be desperate with one accident, one illness, one layoff. But we won't see any significant steps that are taken towards solving these problems. Instead, you can bet your bottom dollar that after the next election, the next legislative session will start with more of these listening tours. What we need are legislators who are focused on reaching across the table and finding bipartisan solutions that are actually going to bring some relief to middle-class working families in Wisconsin. And let's be clear, there is no lack of Republican desire amongst some lawmakers to work on a plan. But their leadership either can't or won't let them act on it. Like so many other issues, when you play politics with it, it's easier to divide people and win elections so that you stay in power rather than doing the hard work of crafting out actual solutions. There needs to be more of that. But to have that happen, there has to be change in who represents us in Madison right now, especially from western Wisconsin.
Well, Bush gave $112 billion to the pharmaceutical companies and the insurance companies, and all they do is fight us every step of the way to give health care to the people. And really, we don't need insurance companies in the health care system. We pay 20% of our gross national debt for health care for 40% of the people, and the rest of the world only pays 8%, and they insure everybody in the country. So, I mean, the answer's there. You just have to eliminate the insurance companies and take the money that's spent today and just insure everybody.
People are paying attention to the solutions now, not just the problems, and that tells you they are ready for action, which includes the sacrifice, but also includes the benefit of security for working families in the state.
Well, look how simple this is with myself. First of all, I'm a retired Teamster. I have Teamster health care. Then I'm old enough to have Medicare. Then I'm a veteran, so I have veterans care. So that gives me 3 insurance policies when there's farmers out there with no insurance policies at all. And there's the rest of the working people are out there with no policies at all.
The system is a mess. There are solutions to fix it. There is hope. We need to make a commitment to making that hope turn into reality.
This has to be a solution that works not just with the business industry, or the business sector rather, but with organized labor, with all of the unions that are out there, with workers that are out there who aren't represented. This has to be a win-win for everybody, and that means there's going to be some give and take on this. People who understand that there are going to be compromises and cooperation are going to get this problem solved. But there is no way that you can ram one partisan solution through. It won't work on either side of the spectrum. So we need legislators who are willing to work on those solutions and not be afraid to be seen rubbing elbows with somebody from the other party, because that's just the kind of games that certain people want us to keep playing. We don't want to play that anymore.
Yeah. So these people are all falling away. They're not covered, or they have very, very poor coverage. Or they may lose their coverage if they become sick. Again, the solution is to put everybody in the same pool. And so we spread out the risk among everybody. The entire state of Wisconsin can become one pool, or it could become regional pools. When I'm out campaigning every day, I talk to people who are suffering, people who have had a baby and they find that their insurance company won't cover the cost of having the baby. I talked to a man in Jackson County who was married for 5.5 months, and then his wife conceived, and because he hadn't been married for 6 months, none of the insurance wouldn't cover any of the costs of the baby, so he was out $12,000. I talked to a gal yesterday that lives over in Independence, another farmer, and she just had a baby, and her baby was high risk, and she could not find a plan where they would have maternity coverage. And so she said, we've paid $12,000 out of our pocket already to have the baby, and it looks like we may spend another $3,000 just to get him through his first year of life. I talked to a farmer down in Jackson County in Garfield Township, and his wife has hypertension and he had diabetes, and they were dairy farmers, and the only way they could get coverage was if they paid $500 each for a policy that had a $10,000 deductible. And you know, if someone has diabetes or hypertension, it's extremely important that you pay attention to all those little medical needs along the way so we don't end up with someone that's very sick. I remember talking with a gal in Blair who's a dairy farmer. She has the #1 highest producing herd in Trumbull County. She and her husband are young farmers. They're in their mid-30s, and they have 2 little kids. And she couldn't find insurance. They're without insurance. And she said, every day I worry that my little kid gets sick and I don't know what I'm going to do. And he wakes up in the middle of the night screaming, and I don't know if I should take him to the emergency care. I work 16 hours a day on the dairy farm, plus taking care of my children. And I went to town to an insurance broker and said, please, can't you help me find affordable health care? And he looked at her and he said to her, lady, you're just going to have to get a real job. As if dairy farming isn't a real job. This system is broken. We need to do something about it. People are in so much pain. And the people that are making the decisions, the people that are leaders, the people that are in medicine, they're not doing what needs to be done. They don't hear the people's cries. They don't hear their troubles. They don't represent their interests. And I'm saying, why? Why can't we do something? And it's time. It's time.